We will talk about hearing loss, how to define it as severe or mild, the top 7 causes, and treatments or prevention. Mild hearing loss is when you hear normal speech in a quiet room but struggle in noisy environments, like a restaurant. Moderate hearing loss is when you hear in a quiet room but need repetition occasionally or can't understand a cashier at the mall. Severe hearing loss is when you need people to speak loudly or shout to understand them clearly in a quiet room. Hearing occurs because sound travels to our ear canal, hits the eardrum, causing it to vibrate. These vibrations move 3 tiny bones in the middle ear, amplifying the sound. The vibrations shake the fluid in the inner ear, where hair cells detect them and convert them into electrical signals. The auditory nerve carries these signals to the brain, which interprets them as sound. The most common cause of hearing loss is the damage and degeneration of hair cells in the inner ear, known as age-related hearing loss or presbycusis. This accounts for nearly 40% of all hearing loss cases. It usually occurs after age 60 and progresses slowly. The auditory nerve and cochlea may also deteriorate over time. Conditions like diabetes, hypertension, and poor blood supply to the ear can accelerate hearing loss. Tinnitus, or ringing in the ears, is also common. Early signs of age-related hearing loss can appear after age 40, especially in workers exposed to noisy environments or those who use antibiotics like tobramycin, gentamicin, or streptomycin. By age 80, most people have at least moderate hearing loss. Smoking, poor diet, and lack of physical activity worsen the condition, while a healthy lifestyle can reduce the risk. The second most common cause of hearing loss is noise-induced hearing loss, accounting for around 30% of cases. Acoustic trauma from explosions or gunshots causes immediate damage. Cumulative exposure to high noise levels, such as machinery, concerts, or loud personal audio devices, can progressively damage hair cells in the cochlea. The main mechanism is that hair cells in the cochlea bend excessively in response to loud noises, leading to damage or death. These cells do not regenerate, resulting in permanent hearing loss. Loud noises also increase the production of reactive oxygen species in the inner ear, leading to oxidative stress and cellular damage. If hair cells die, the hearing loss is irreversible. However, after attending a loud concert, you might experience ringing in your ears, tinnitus, and muffled hearing, which usually resolves within a few hours to a few days as the hair cells recover. This partial damage allows for some recovery over time. The third most common cause is ear infections, especially in children. Middle ear infections and inflammation due to bacteria or viruses can cause inflammation and fluid buildup in the middle ear. Children often experience ear pain and fever, along with muffled hearing or temporary hearing loss due to fluid buildup. Sometimes, the eardrum ruptures, allowing fluid to drain from the middle ear. Most cases result in temporary hearing loss that resolves with treatment and fluid drainage. However, repeated or chronic ear infections can damage the middle ear structures, potentially leading to permanent hearing loss. In 5 to 10% of cases, hearing loss is caused by medications. High doses and prolonged use of ototoxic medications can cause hearing loss. These include antibiotics like aminoglycosides, tobramycin and gentamicin, chemotherapeutic medications, and loop diuretics like furosemide. High doses of aspirin and other NSAIDs can lead to temporary hearing loss, as can antimalarial medications. Loop diuretics and aspirin usually cause short-term hearing loss, while chemotherapeutic drugs and antibiotics more commonly cause permanent hearing loss. Trauma, earwax blockage, and Meniere's disease also cause hearing loss, but much less commonly. To prevent hearing loss, it's important to maintain a healthy diet, exercise regularly, manage chronic conditions, avoid smoking, and reduce noise exposure. These measures can decrease the risk of hearing loss by around 30 to 40%. If you work in a noisy environment, use ear protection, reduce exposure to loud noises, and have regular hearing checks. A good rule of thumb is that if you need to raise your voice to be heard by someone an arm's length away, the environment is likely above 85 decibels, which is potentially harmful with prolonged exposure. For example, motorcycle noise is around 90 to 95 decibels and should be avoided for more than 2 hours. Busy traffic and restaurants are around 80 to 85 decibels, and you shouldn't stay there for more than 8 hours. For treating age-related hearing loss, common treatments include hearing aids, which amplify sound. They are electronic devices that look like headsets. Cochlear implants are another option. They are implanted devices that bypass damaged hair cells and directly stimulate the auditory nerve. Though still experimental, they are highly effective in many cases. Auditory training, including exercises and therapy, helps improve listening skills and adaptation to hearing aids. Cognitive behavioral therapy can help manage tinnitus, and sometimes antidepressants like amitriptyline or anti-anxiety medications like alprazolam are used. Antioxidants such as vitamins A, C, E, and magnesium may help prevent hearing damage from loud noise but are not primary treatments. For ear infections, commonly used antibiotics include amoxicillin, augmentin, cefuroxime, and azithromycin. Common ear drops include ciprofloxacin and dexamethasone, as well as polymyxin B, neomycin, and hydrocortisone. For ototoxic medication, the solution is to stop such medications if possible. Antioxidants like N-acetylcysteine may be used experimentally to protect hearing. For earwax blockage, softening agents such as carbamide peroxide or hydrogen peroxide drops are used to soften the earwax.